let's talk about frequently asked question about surgical mesh. One of the most common question that my patients ask me is, hernia surgery with mesh safe? And obviously I have been in practice for 20 years in Southern California, and my main focus is hernia repair, and I have done thousands of hernias, and I had the opportunity to follow these patients in the long term. And recently I published my results for inguinal hernia repair with mesh in a journal of robotic surgery in 2018, which was the outcome study of following up almost 159 hernia that I did for 32 months. And in that follow-up study, we showed that the risk of this operation was extremely low. The risk of recurrence was 0.6%. We did not have the patients with chronic pain, and the results were significant. The other frequently asked question about surgical mesh that most of the patients ask when they come to my office for consultation is, can hernia surgery be done without mesh? Yes, but sometimes. It really depends on the type of hernia, the size of hernia, and the location of the hernia. And on the other hand, it's related to the patient characteristic. For example, their age, their medical problems, their muscle strength and tone, and also their expectations. For example, the patients that come in with a large hernia in the groin area, it's almost impossible to fix them without the mesh in the right way. Obviously, there are centers and people in this country or in North America that they repair the hernia in the groin region without the mesh, but majority of those patients, they have a high risk of recurrence. So in my practice, inguinal hernia or groin hernia is done majority of times with the mesh. But there are other locations that you can prevent using the mesh, for example, in the abdominal wall, especially in a patient who has a good strength and tone of the muscle, and the hernia is not that big, that you can bring the muscle beautifully with suture, and then that way you prevent using mesh or foreign body in those patients. So when patient comes to my office, again, we have a very comprehensive history and physical exam, and I talk to the patients, examine them in detail, and then come up with the best type of operation for them. And also we discuss about the upside or benefit and downside of Oasis. But what is the downside of not using mesh in hernia repair? Obviously, when we close the muscle together with a suture, we rely on the suture and also the muscle strength of the patient and the scar tissue that it developed within 6 weeks, so the hernia does not recur in the future. But most of the studies shows that between 5 to 10% of the hernias, they can come back if you don't use the mesh. But that 5 to 10% really depends on the size of the hernia and the location, and again, other characteristics of the patients. So if the patient has a very large hernia and has overweight, therefore there's a lot of tension when you close the muscle together, and if you don't use the mesh, that patient has even higher than 10% risk of recurrence. But if you have a small hernia on a patient that is athlete and does exercise and has a very good tone of the muscle, so closing it with a suture has a very low risk of recurrence. So I will determine that by talking to the patient and examining the patient, and also evaluating the best type of operation for the patient. For example, this patient had a laparoscopic primary repair of the ventral hernia. As you can see, he had called a supraumbilical ventral hernia with a bulge. That was a piece of fat was coming out of the defect and causing this bulge. But when I went into the operating room and I did the surgery, the actual hole and defect was small. Even though this patient was overweight, but I was able to close that beautifully without a major tension on the wound. So I decided not to use the mesh, and this patient did very well and did not have any recurrence of the hernia. Another frequently asked question about the surgical mesh is that, can mesh migrate or reject? Well, mesh can migrate, especially the first 2 weeks, because the mesh is a plastic material that we as a surgeon place next to the muscle. And it's very flimsy in the first couple of weeks. So with the aggressive movement or exercise or even heavy cough or a sneeze, you can move this mesh from side to side and create problems in the future. So they are very vulnerable the first 2 weeks. They usually stick to the tissue after 2 weeks, but they don't get a full strength up to 6 weeks. So in my opinion, for the first 6 weeks, the patient is not able to do heavy exercise and heavy exertion to increase the intra-abdominal pressure, because that's the time that the mesh is very vulnerable to migrate and move. The other thing that happens is this mesh, when it gets scarred down and incorporates into the muscle, some of these meshes, they can contract and retract, and they get folded on the edges. And depending on the type of material, that can be more than in some of the meshes than others. But essentially the way we place it, we try to minimize that as much as possible. So one of the things that I do, for example, is the patient is very thin and don't have any soft tissue coverage over the top of the muscle. I would not put the mesh on the top of the muscle, because with the folding, eventually they can cause pain and discomfort for these type of patients. Rejection, in my opinion, is a myth, is not correct. We have absolutely foreign body reaction in almost 100% of the patients, but I would not call that a rejection. So the rejection is a myth and is not true, but we have inflammatory process due to a foreign body reaction when we place the mesh in the soft tissue next to it. Another frequently asked question about the surgical mesh is, can mesh be removed? Obviously, we said that mesh will create exaggerated scar tissue, and the scar tissue will grow into the mesh and incorporate that into your soft tissue or muscle. Now, it's very difficult to remove the mesh, and therefore it really depends on the location of the mesh, whether we're able to remove it safely or not. So we always evaluate the patient and see the risks and benefits of removing the mesh. Obviously, if the mesh is close to the major nervous structures or blood vessels, removing it can cause actually more damage for the patient. So on those people, we do alternative therapy. For example, if they come in with the chronic pain, you can use different type of modality of the pain control, including injection with a steroid to decrease the pain and discomfort, instead of going in and digging through the tissue to remove portion of the mesh to basically relieve the pain. Obviously, if the mesh is located in an area that is safe to be removed, or if it's infected, or if it's stuck to the bowel, you have no other option other than removing the mesh. But the surgeon will determine that during the initial examination and discussion. Another frequently asked question about surgical mesh is, how can we diagnose the mesh problem? So obviously in my practice, I have a lot of patients that are coming in for second opinion after having hernia repair with other surgeons, and the most important thing to diagnose the problem with the mesh is the very comprehensive history and physical exam to understand the type of pain and the issues that they have, and that basically gives you an idea whether it's related to the mesh or it's a new problem or it's a completely different issue that patient's suffering. We have X-ray modalities like ultrasound, CT scan, and MRI, which could be helpful to rule out, for example, hernia recurrence as causing pain and discomfort, or even evidence of blockage of the intestine and scar tissue formations based on those results. Understanding the type of operation and type of mesh that patient has is also very important, but at the end, if the patient is really not suffering, is not a very major complications, we can use conservative modalities and therapies in order to see if they go away before you perform any type of surgical intervention for that patient. Another frequently asked question about surgical mesh is, can patient feels the mesh after the hernia surgery? It really depends on the location of the mesh and type of hernia and the patient's body habitus. For example, when we talk about a very thin female or patients that does not have any soft tissue coverage for the muscle, and the mesh is placed on the top of the muscle, these meshes, they can be folded and contracted, and then later patient can feel them and actually can cause them pain and discomfort with the movement and activity. Majority of patients that we do minimally invasive surgery and place the mesh behind the muscle, they don't feel the mesh. They might feel some discomfort when they do activities and heavy work, but there's no nerve in that area for them to feel the actual mesh. So some people coming in and they have discomfort during the movement in the groin area, and they feel like they're feeling the mesh, but it's not actually the mesh that they feel, it's just discomfort due to inflammatory process, and a lot of times it will disappear after a while. Finding and customizing the appropriate surgery for the patients and not placing the mesh in the area that patient may feel it is very, very critical. So I hope this conversations about mesh and hernia was helpful, and please like my video if you really enjoy these conversations, and share that with your friends, and also subscribe to my channel, because I have not only more educational videos but also a lot of videos about the actual surgery that you can watch and learn, and also that may increase the understanding of the hernia surgery and why we use mesh to repair these type of hernias. If you would like to contact me for consultations, I'll be available on my phone 949-646-844, or we can actually do consultations over the phone or telemedicine. Thank you.